Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here.
Hi, everyone. This is Madeline, and Amanda Frederick as your Fiat Women's Health team. And today we're going to be talking about recurrent miscarriages a little bit more in depth. So we touched on it in our last episode, if you're able to listen to that. If not, no worries, because we'll be talking about it in depth here today. So I'll have you lead us off, Amanda, talking a little bit about what are some reasons and some driving forces behind why women experience miscarriages and so on.
Absolutely. So miscarriage is, of course, a very heartbreaking thing that occurs in the population. Some sources say up to 25% of pregnancies end in miscarriage. And so we definitely take every pregnancy very seriously and look at every miscarriage as a terrible loss and something we'd like to prevent. Typically, there's a lot of different causes for miscarriage, from genetic disorders, chromosomal problems, which is what we probably hear the most about when people are talking about it. Definitely structural issues in the uterus can cause miscarriage, things like polyps or fibroids, or even C-section scar defects. It's called an isthmocele, can sometimes be a problem. Definitely immune issues, autoimmune diseases, but also elevated natural killer cells, cytokines, those sort of things. And then, of course, there's inflammatory conditions that can contribute as well, like chronic endometritis is a common source of infertility, but also can cause recurrent pregnancy loss. And that is a microbiome issue where there's bacteria or viruses growing in the uterus. So those are some. There's definitely hormonal issues, thyroid problems, clotting disorders, definitely the broad gamut of things. And so a workup has to be pretty detailed in order to get to the bottom of what might be going on. So can you tell us a little bit about what our workup here at Fiat looks like and what kind of questions and things we ask women as we are trying to get to the bottom of recurrent pregnancy loss?
Yeah, absolutely. So when we are seeing these patients for, recurrent loss, we do have a pretty set criteria of things we like to ask patients and check on and assess as part of our workup, and really helping us to tease out and differentiate what might be underlying all of these miscarriages. So as far as we definitely start off with, pregnancy history. So, how many times have you been pregnant? What did those pregnancies look like? If there were past miscarriages, at what age, at what gestational age did you experience those miscarriages? How the pregnancy progressed up to that point? Any complications in pregnancy or in delivery? Did you have ultrasounds? Did you have a C-section or a vaginal birth? And then any complications in there, emergency C-sections, anything like that. We do ask, have you had any miscarriage testing up to this point? And that can be a variety of different things that we'll get into. Progesterone use. So have you been on progesterone in the past or with past pregnancies, or are you currently on progesterone? Because progesterone and healthy, sustainable progesterone levels are very important, obviously, to sustaining a pregnancy. Thyroid testing. So when was the last time that a patient had any thyroid testing done? Or are they currently on any thyroid medication? Because the thyroid plays a huge role in conception and progression of a healthy, normal pregnancy and baby's development. Are you on anything like aspirin, which might give us clues into maybe they've had clotting testing done in the past or anything like that? And then do they have any known women's health problems? And that can vary from, known clotting disorders or genetic issues, or any immune system problems, autoimmune disease, things like that. And then we definitely want to get a pretty extensive health history. So, at what age did you have your first menstrual cycle? And were those cycles normal? Do you have monthly cycles, leading up to conception? How many days do you typically bleed? Any spotting or brown bleeding? Do you track your fertility? And at what point in the cycle do you notice changes that signify fertility? All of those things, we're looking for any clues into underlying issues of hormonal imbalance. Maybe if a cycle is too long or too short, or we have lots of significant brown bleeding, those are big clues for us that there might be some underlying hormonal imbalance. And then on top of that, very important for us to ask about, what does your diet look like? Because diet obviously is a huge part of our overall health and well-being. How about exercise? Are you getting out and moving your body, regularly and helping to regulate healthy insulin and glucose levels? How about caffeine intake? Are you excessively intaking caffeine? And then any past history of, known insulin resistance or gestational diabetes, again, looking for that relationship between insulin and glucose and if that could potentially be something underlying as well. And then from there, we typically we have a set few things that we like to recommend as far as supplements are.
As far as the supplements are concerned.
Yes, as far as the supplements are concerned, we like to touch on that and then talk about different testing. So Amanda, maybe you could go into different testing and, maybe supplements or how we might manage from moving forward.
Absolutely. So it's definitely very important for any woman trying to conceive, whether she's had recurrent loss history or not, to be on a strong prenatal vitamin that has methylfolate in it. Choline is also important. So we definitely make sure to recommend a prenatal that is going to be very high quality, and ideally starting at least 4 months before trying to conceive again is a good idea. As far as further testing goes, a lot of the questions we ask in terms of the pregnancy history can kind of clue us into what might be going on. So if a woman is having recurrent loss where a baby is seen on our ultrasound with a heartbeat at one point and then the heartbeat stops later on, that is a different situation than a woman who is having losses at 4 weeks over and over again, where she can never make it to the first ultrasound. And so each kind of gives us a clue on what might be going on. And so we have different tiers of testing, and depending on a woman's history, we'll recommend a certain level of tiers of testing. A lot of women, if they've had one miscarriage, warrant a certain amount of testing, but maybe not the full gamut. Whereas if a woman has had 3 or more miscarriages, doing everything to get to the bottom of that is very helpful. So our first tier of testing is basic testing that we would do on any type of fertility evaluation: progesterone, estrogen, male hormones, prolactin, thyroid, insulin resistance markers like hemoglobin A1C. Sometimes we'll do a glucose tolerance test. All of these will give us an idea of if the hormones and the thyroid are functioning normally in the cycle. Typically, we do this on cycle day 21 or 7 days after ovulation if a woman is tracking her ovulation. And this gives us a good place to start. For a lot of women, we will also do antiphospholipid syndrome testing if they've had 1 or 2 losses. This tells us if they have an autoimmune clotting disorder. It is definitely a cause of recurrent loss, and if a woman has it, she absolutely needs to be treated in order to have a successful pregnancy. So that's kind of our second tier of blood testing. The third tier is further thrombophilia testing, but these are inherited thrombophilias, so the kind that you're born with. And some of the ones that we typically do that can cause a lot of trouble in pregnancy are factor V Leiden and antithrombin activity, and there's a couple others as well. There's some secondary ones we'll do at times, depending on the situation. But a lot of women who come up positive for one or more of these clotting disorders definitely need to be on a baby aspirin in pregnancy, but depending on the disorder, may need Lovenox in order to sustain a pregnancy moving forward. So those are the main blood tests we do. In some cases, we will do immunology testing as well. This is very specialized testing, and a lot of times, if a patient comes up positive for this, their best option is to see a reproductive immunologist, but we'll test for natural killer cell testing and cytokines, and there are a couple others as well that can be done. But if an immunologic disorder is at the root of implantation failure or recurrent pregnancy loss, a lot of times doing an immune protocol through a reproductive immunologist is the best bet for that. And then our tier 5 is genetic testing, which requires blood testing from both parents. And this gives an idea as to if the couple is prone to have a baby that has a specific genetic disorder. And so these tests can range anywhere from 60 to 400 some tests for genetics. And then the parents are compared to each other to see if they have a certain risk of genetic disorder. And if they do, genetic counseling is usually warranted. The final type of test that we do sometimes, and this would not be a blood test, but it's more of a structural test, is to do a saline-infused ultrasound on cycle day 5 through 12 to look for structural problems. This can also pull up a ismocele, which would be a C-section scar defect if a woman has had a C-section in the past. But polyps, scar tissue, that sort of thing will show up on this. There's also, as sort of an aside, for a woman who hasn't had a successful pregnancy or has most of her testing normal and there's maybe period pain or something else going on, having an endometriosis laparoscopy is also warranted, especially for someone who's had 2 or 3 losses without any known cause, because endometriosis can be part of that structural issue that can cause recurrent pregnancy loss. And then finally, we will do evaluation for endometritis or uterine inflammation caused by an infection. Sometimes this can come about and have symptoms like chronic pelvic pain or chronic brown bleeding at the end of the period. It is a common reason for implantation failure as well. And because the uterus is where it is, it can be hard to access and hard to evaluate for endometritis. So an endometrial biopsy is required in most cases, though there's new testing now from Fertilizis that can test for endometritis and microbiome issues off of menstrual blood, but it's definitely a new up-and-coming thing that we are just trying. So that pretty much sums up the major testing that we do in recurrent pregnancy loss, depending on the situation and based on the prior pregnancy history.
Awesome. Yeah, I think that sounds great. And hopefully that answers anyone's questions. But if anyone listening does have questions, feel free to reach out to our clinic and let us know what you'd like us to talk more about on here. Amanda, do you have anything else you'd like to add before we end?
I think that sums it up. So thank you for listening.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.